Hi, my name is Cindy Bertolino, and I will be doing a neurologic assessment today. Can you state your name for me?
My name is John Camp,
And your date of birth?
01/25/87.
Okay, can you tell me the date today?
Today is Wednesday, November 9th,
Okay.
2016.
Okay, great. And where are you at today?
I'm at Barnes Jewish Hospital.
Okay, great. Let's go ahead and start with the cranial nerves. We'll start with cranial nerve 1, which is the olfactory cranial nerve, and it is assessing your sense of smell. I'm going to go ahead and have you occlude one of your fingers and go ahead and smell this and tell me what you smell.
Peppermint.
Okay, and the other one?
Peppermint.
Okay. Oftentimes this test is not done in the office. If it is done, usually someone brings in cinnamon or peppermint, something like that, to assess that cranial nerve. We'll go ahead and move on to cranial nerve number 2, the optic nerve. I'm going to assess the red reflex. Just go ahead and look straight ahead. And in the office, I would be using an ophthalmoscope, and I would also be looking deeper into the eye, looking at the optic nerve and the optic disc in both eyes. Cranial nerve number 3, ocular motor, pupil constriction. Going to look at direct, go ahead and look straight ahead at me again, the constriction of both pupils, so direct, and then I'm also going to look at consensual, and making sure that both the pupils are equal, round, and equal to light accommodation. Cranial nerve 4 and 6, trochlear motor, or trochlear and abductans. Here we're going to use the 6 cardinal movements, so keep your head straight, and I want you to follow my finger with just your eyes. Okay, great. Moving on to cranial nerve number 5, the trigeminal. We are going to assess motor function of the jaw. I'm going to place my hands on your jaw. I want you to go ahead and clench your jaw, okay, and then take your jaw and move it from side to side. Great. Okay, next I'm going to grab a Q-tip and I'm going to assess your sensation. I want you to close your eyes and tell me if you feel soft, dull, or sharp.
Soft. Sharp.
Okay, great. Cranial nerve number 7, facial. I want you to go ahead and smile without showing your teeth. Frown, puff your cheeks, wrinkle your forehead. Great. Okay, cranial nerve number 8, acoustic. Here we'll do the whisper test. You can either have the patient occlude one ear, go ahead and occlude your left ear, stand on the patient's other side, say a word or a phrase.
Apple.
Okay, and go ahead and occlude the other ear.
Banana.
Okay, great. We'll also use our tuning fork here, and we will do the Weber and Rhine test. I will strike the tuning fork, place it on her head, and I want you to tell me when you no longer feel the vibration.
No.
Okay, and we'll do the Rhine test, testing bone versus air conduction. Strike the tuning fork, place it on the mastoid process. Tell me when you no longer feel the vibration.
No.
And tell me when you no longer hear the vibration.
No.
Okay, and air conduction should be twice as long as bone conduction. Cranial nerve number 8, glossopharyngeal. Here we're going to test the patient's swallowing ability. I'm going to go ahead and ask you to swallow. I'm just going to visualize her ability to swallow, noticing any deficits there. And John, go ahead and open your mouth for me. I'm going to assess her hard and soft palate. Say ah. And her uvula, and noticing the function of her uvula when she says ah. That's also assessing cranial nerve 10 as well, which is the vagus nerve. Cranial nerve 11, the spinal accessory. John, I'm going to place my hands on your shoulder. I want you to go ahead and shrug your shoulders against my resistance, okay? And then go ahead and turn your face towards the resistance of my hand, and your other side. Great. Okay, cranial nerve number 12, the hypoglossal. Shauna, go ahead and stick your tongue out and move it from side to side. Great. You're noting any deviation of the tongue there. Her tongue looks midline and no obvious issues. Moving on to cerebellar function and coordination of fine motor skills. Jana, I'm going to ask you to go ahead and step down and walk to the door for me. I'm observing Jana's gait. Okay, come back towards me. The movement of her arms as she walks. Her posture. And Jana, next I'm going to ask you to walk heel toe. Great. And then if you could walk on your heels. Okay. And then walk on your toes. Okay. And then if you could do a shallow knee bend for me. Great. All of that looks nice and steady and no obvious issues there. Okay, go ahead, Ajana, and have a seat back on the bed for me. I'm going to assess your muscle tone and strength. Go ahead and stick your hands out for me. With your fingers spread apart, go ahead and try to squeeze your fingers together against my resistance. And on this side, great. And then close your hands and try and separate your fingers against my resistance. Okay, make a fist for me, Shauna. And I'm going to place my hand on your wrist. I want you to try and bend your hand up towards my resistance of my hand. And this one, okay? And then push down towards my hand, and this one, great. Okay, moving on to your elbow. I want you to go ahead and push your hand back towards the resistance of my hand, okay? And push this way. Okay, this hand pull towards me against the resistance and push. Great. Okay. Shoulders again, push against the resistance of my hands. Okay. And then we're going to do this here. And I want you to push against the resistance of my hand here and here. And push against the resistance of my hand on the both sides. All right, we are going to move down to your feet, and I want you to push against the resistance of my hand and on your left foot, okay? And again, push against the resistance of my hand and again. Great. Okay, when we do those tests, we compare one side to the other. I'm going to go ahead and have you lay down. Okay, and we are going to go ahead and assess the same thing. We're continuing to assess the flexion, extension, abduction, and adduction against resistance. Here you continue with the knees. So go ahead and bend your knees, Jana. I want you to push against my hand. Okay, and then on the inside, I want you to push against my hand and outside, and you would do that on both legs as well. Okay, Jana, I'm going to have you sit up, and I'm going to have you stand. I'm going to move this a little bit this way, so you can see this test fully. Next, we're moving on to the Romberg test. Shauna, I'm going to have you close your eyes, stick your arms straight out, palms up, and here we are watching to make sure that the patient's palms remain with no drifting, and that looks great. We can also do the pronator test here. Apply pressure to the hands, and the palms should return to that position where they started, and that looks great. Moving on, Sean, I'm going to have you sit back down. We are going to assess superficial touch and pain. If you could close your eyes, I want you to tell me if what you feel is sharp, dull, or soft.
Sharp. Sharp. Soft.
Great. Okay. And then we are going to test vibratory response. We'll use our tuning fork again, and we're going to use this on bony prominences and joints. We'll assess the feet and hands. So we'll take the tuning fork, we'll strike it, and we'll actually place it on the patient's sternum to make sure that the patient feels the vibration. You feel the vibration? Okay. Then we'll move down to the big toe and make sure the patient feels the vibration there.
Yes.
Tell me when you feel it. And then we will move to the ankle.
Yes.
And to the tibia.
Yes.
Okay. Striking the tuning fork again, you will place the tuning fork on the patient's thumb. Tell me when you feel the vibration.
Yep.
And onto the radius.
Yep.
And onto the patient's elbow.
Yes.
Great. There you're testing the patient's sense of vibration. Next, we will test the patient's, I see if the patient can identify a familiar object. This is called stereocynosis. John, I'm going to ask you to close your eyes and just open your palm, the palm of your hand. You're going to place a object in the patient's hand, and the patient's going to feel the object. And what do you feel, John?
Coin.
Great. Here you're assessing if there's any type of brainstem dysfunction. Two-point discrimination. Here you are going to take a bobby pin or a paper clip, and you're going to separate the 2 points, and you're going to touch the patient on the hand. Jana, close your eyes, and you're going to ask the patient, do you feel, tell me if you feel 1 or 2 points.
2.
Okay.
1.
Okay. And then we're going to move down to her leg. And Jana, tell me if you feel 1 or 2 points.
1.
Keep your eyes closed, Jana, no cheating. Okay, and again.
1.
Okay, so on the hand, the distance between the 2 points, the patient can feel, it should be a smaller distance between the 2 points, and they should be able to discriminate the 2 points. On the larger muscles, the distance needs to be wider for them to discriminate the 2 points, that they're feeling 2 rather than 1 point with the objects. Okay, Jana, next we're going to do a test called graphesthesia. I need your palm again. I want you to close your eyes, and I want you to tell me what number I'm drawing.
4.
Great. Next, I want you to close your eyes again, still continuing to assess sensation. I'm going to touch you on your body, and I want you then to tell me where I want you to point to where I touch you. Okay, open your eyes and point to where I touch you. Perfect. Most people don't get exactly, but as long as they're in close proximity is what we're looking for. Next, we will assess DTRs. We will start with the brachial radial DTR. Okay, and we will be assessing this on both sides. I will just do the one side for the video purposes. The bicep, you can also strike your hand if need be. And then the tricep, You're going to strike right behind the elbow. Okay, and then the patellar, which is the most common DTR that most people think of when you talk about DTRs. And then the Achilles. Okay, and then I'm going to have you lay down, Jana, so I can assess the superficial abdominal reflex. I'm going to pull your shirt up, Jana, here. I'm going to take the other end of the DTR reflex hammer, and I'm going to start at the umbilicus and just gently carry it along her belly, and I'm going to watch for the abdominal muscles to contract. And there should be a normal contraction of the abdominal muscles. While you're laying there, Jana, I'm going to go ahead and actually I'm going to remove your shoe for this part. I'm going to do the plantar reflex. I'm going to take the end of the reflex hammer again along the bottom of the foot, and in adults there should be a normal flexion with the plantar reflex. And then finally we will assess for clonus. We are going to do a rapid flexion of the ankle, the foot, and we should look for any beats of clonus after the flexion of the foot. 5 beats of clonus or more is abnormal, and this test here is testing the integrity of the spinal cord. Okay, Jana, that's the end of our neurologic exam. Thank you.